name is Joaquim Ferreira. I'm a neurologist and I'm working at the University Hospital in Lisbon. I'm not just a neurologist, I'm also working as a clinical pharmacologist. So my interest in dystonia comes from these two topics, neurology and clinical pharmacology. And clinical pharmacology means finding the right treatments or using the right treatments, to approach this disease, and that's my background. I've been working with dystonic patients and in this field since 1989. I was a medical student when for the first time I began working with dystonia in some way, so I've been following all the progress in dystonia since I was at university as a student, not working as a physician or working at university. And it was a nice trajectory, because I can say, so I entered at university in '86. I graduated as a doctor in '92. And I began, doing treatment in '89. So really at the primordials of the use of botulinum toxin. So I have many stories. When I see a dystonic patient for the first time, my main concern is to be able to explain what is a disease. Because sometimes just the fact that we communicate a diagnosis makes the difference. You are telling someone that strange posture, it's not because there is some psychiatric problem or something that is bizarre in nature, but there is a reason, and the reason is it's a disease that has its logic, it's rational, and it results from a brain problem. So it's not his fault. It's caused by something, but it's not his fault. So there was nothing in his past that in some way predisposed him to have the disease. And I think that's the most important thing. And again, dystonia, it's clearly it's a rare disease, but it's underdiagnosed. So we clearly look for more patients because we are sure that there are more patients around not having the proper diagnosis. Even when there is nothing to offer in terms of efficacious treatments, it's important that patients have the correct diagnosis. But it's even more important when you have treatments that really work. And we have pharmacological treatments that work, are efficacious, are beneficial for the patient, and we have surgery that it's also extremely efficacious for some patients. So it's even more important for us, to reach those patients for which we have something really concrete to offer. So clearly, my main concern is to be able to explain, and also explain what are the alternatives available. If at least you are able, to promote an enhanced knowledge about the disease, and if by your initiatives like the one we are doing now, are able that patients that are lost, and not even being able to know what's the name to call to their problem, and if they feel something good from having the right diagnosis and reach the right center to be treated, it's already something that I would say that it's amazing, because it's the individual patient that counts.